Oh my god. Oh my god.
Is my scene safe?
Yes.
How many patients do I have?
One.
What seems to be the mechanism of injury?
17-year-old male hit by SUV.
All right, assuming C-spine, passing C-spine off to my ghost partner. Hey, can you hear me? Visually aware. No pain response. Patient is unresponsive. We're gonna go ahead and start ventilating the patient via BVM. Opening the airway with the head tilt jaw thrust. Passing BVM off to my ghost partner. I'm gonna go ahead and check his carotid and radial pulses. Seems to be strong and present in both. Patient's skin is warm and dry, but pale. We're gonna go ahead and disrobe the patient. All right, the decision is going to be a let and go based off of the mechanism of injuries. We're going to go ahead and start evaluating the patient for any major bleeding. Seems we have blood behind the neck. Direct pressure, applying gauze. Neck is intact. Seems we have left-sided root fracture to the chest. Assessing abdomen. No rigidity in the abdomen. Assessing the pelvis. In, down. Pelvis is intact. Assessing lower extremities. We have a possible left-sided leg fracture. A possible fracture to the arm on the left side. We're going to go ahead and apply a cervical collar to the patient. Cervical collar is in place. I'm now going to log roll the patient. With my EMT team ready, we're gonna log the patient on 3. 1, 2, 3. Now I'm going to assess the posterior of the patient. No bleeding at the back of the head. Bleeding that we have assessed has been treated. The back is fine. Posterior legs is fine. We're now going to log the patient into the backboard. 1, 2, 3. I'm now transporting the patient. We're now reassessing the patient during transport. So I'm going to go ahead and take the patient's blood pressure. blood pressure is 160 over 90. Checking patient's heart rate. Heart rate is 140. Pupils seem to be pearl. Palpating the head for any other injuries. Assessing the neck, chest, palpating the abdomen, assessing the pelvis, lower extremities, upper extremities, everything seems to be normal.
This is EMT student Demir San transporting a 17-year-old male patient who was hit by an SUV. Patient is currently unresponsive with the pulse. Injuries include bleeding posterior to the patient's head, possible fracture to the ribs left side, fracture to the radius left side, and tibia left side. Patient has a blood pressure of 160 over 90 with the heart rate of 140 and an oxygen saturation of 98%. Respiratory rate is 4 breaths per minute, and patient's skin is warm and dry but pale. Pupils are pearl. Patient is in a cervical collar and being ventilated via BVM. ETA is 5 minutes.